Okay, so it's 1 o'clock, so let's go ahead and get going. Greetings, everyone. My name is Bob Emery. Greetings from the University of Texas School of Public Health here in Houston, and another edition of TEPHI Talks. TEPHI stands for the Texas Epidemic Public Health Institute, and we've been doing these recurrent webinars for since the pandemic began 3 years ago, about keeping the public safe, but also making sure that we have a vibrant economy and to move it along. And so we've had a series of presentations from various business sectors to speak about what the experiences were like, but more importantly, what are we doing going forward? And so we have a really exciting presentation going on today. But before we get to introducing our speakers, I'd like to kick it over to Dr. Janelle Rios, who's the Deputy Director of TEPHI. Just give you a brief overview of the Institute there.
Hi, everybody. As Bob mentioned, I'm Janelle Rios, and I'm the Deputy Director of the Texas Epidemic Public Health Institute, or TEPHI, as we like to call it. Welcome, everybody. This is an exciting series and truly a business-to-business peer seminar series that we proudly produce every other month. To give you a little information about TEPHI and who we are, this institute that is housed at the University of Texas Health Science Center at Houston, with participation throughout the state, we are committed to keeping Texans safe and the economy strong by strengthening the capacity and resiliency of Texas communities to respond to future infectious disease outbreaks. And to do this, collaborations are critical. We focus on establishing and cultivating partnerships with other governmental agencies, regional and statewide organizations. We partnered with national organizations, professional associations like the one you're about to hear from today, other business entities, other academic institutions, and of course, community organizations throughout the state of Texas. There are many ways to connect with us. So I'm going to linger a little bit here on this slide so you can take a photo of it. We have news and updates that are available. We have webinars every single month, trainings throughout the year, both in person, online, and with our online trainings, they are asynchronous or synchronous. So you can take some of them at your own pace, which is wonderful. You can take them in the middle of the night or any time of day. And then we have some that are live, like this particular event today. I want to draw your attention to the bottom right-hand corner about the Texas Public Health Summit. That's coming up on October 19th. If you happen to be in Houston, we totally welcome you to come visit the summit, which is a day-long event in person. We will also be webcasting that event as well. This year, our theme is wastewater science, and it's going to be an exciting event. So a little bit about our webinar here, a little housekeeping. If you would like closed captioning, click on the bottom live transcript button that you'll see at the bottom of your screen. Feel free to ask questions using the Q&A box, or if you have some comments or reactions, please feel free to use that chat feature as well. As soon as you exit this event, you will receive a survey. So please take that survey and offer up ideas for future TEPHI talks. We really welcome those. Now, we are recording this webinar, and everyone who registered is going to receive an email in about a week with a link to that recording. So without further ado, I'm going to send it back over to Dr. Emery, and he will introduce our honored speaker today.
Okay, thanks, Janelle. Yeah, this is great that Dr. Emily Williams-Knight present to us from the Texas Restaurant Association. I do want to acknowledge the Joe Montestero behind the scenes. Apparently he's we were just chatting about this, that he's the puppeteer behind the scenes, so we'll make it all work. But I did not fully appreciate how expansive the restaurant industry was in the state of Texas, and I was fortunate enough to be invited to speak at the conference that was at the George R. Brown just a couple of weeks ago, and I left there humbled. I had no idea. So I'm really looking forward to this presentation. So rather than going through the longer bio, I don't want to take up Dr. William Nice time, but it's pretty impressive. And I think at the end of the day, people will fully appreciate the importance that the restaurant industry provides to society, perhaps maybe not what they fully appreciated. You have educated me. Let me put it that way. So I'll turn it over from there.
Excellent. Thank you so much. And it really is an honor to be here. I believe the pandemic really did two things. One, for our organization, it sort of repositioned us as a thought leader in Texas, but it also reinforced, I think, to all Texans and especially to our leaders, the importance that restaurants play really in food infrastructure and food framework. I like to say restaurants are ubiquitous. Anyone wants something to eat right now, I can have it delivered to my front door. I can go out to eat. And so it's very easy to sort of, restaurants are always there until they're not. So let's start with what I thought I would do today is the agenda for today is really who do we represent as an association here in Texas? What was the pre-pandemic environment like? What was that COVID-19 journey? And then post-pandemic, and I think most importantly, and this is just so important to me really, is to what did we learn in the pandemic that we were able to then go to the Texas State Capitol in the 87th and 88th and turn some of those learnings into legislation that was eventually signed into law. And I think that is the gift of the pandemic. There were very few, but the one was that we really took a moment to say, what did we learn? What was the goodness that came out of it that we should continue? And then we were able to turn that into, I think 13 or 14 new laws in just the last 3 years. And then I'll obviously leave it up for some Q&A because I would love to answer any questions you have. So the first slide, I think, is who we represent. And so these two definitions are really our mission and definition are key, which is the mission of our organization is to serve as the advocate. So we call it the voice of the restaurants across Texas and to be an indispensable resource for the hospitality and food service industry. We are incredibly interconnected. Restaurants don't stand alone. There's a massive ecosystem from the start of the supply chain all the way down to the farm to that end consumer. And so looking at our restaurants and advocating for what they need to help take care of their consumers safely and to grow their business is our focus. And that's at the federal, state, and local level. If you think about what is a restaurant, that definition has changed. And I would say the pandemic really accelerated that change. And that is when we talk about the restaurant industry, it is all meals, all snacks, and all alcohol that's prepared away from home. And that includes all takeout meals and beverages. And so it's not just a sit-down restaurant. It could be a small eatery. It could be a food truck. It could be a restaurant on a college campus. All of that is referred to as the restaurant industry here in Texas. On the next slide, this is what life looked like pre-pandemic. It was 2019. We had just under 50,000 restaurants. We were second in the nation for number of food service establishments. We were producing about $70 billion in sales each year in the Texas economy. And we had about 1.3 million employees, which was just under 10% of the state's employment. I would say that I stepped into this role about 5 months before the pandemic, murmurs started about something happening overseas. And it was really at this time when the restaurant industry was thriving. So the economy was strong, people were spending, restaurants were opening, the loss rate of restaurants was being reduced, and life was really good for restaurant owners and consumers across Texas. Next slide, Joe. So then COVID-19 hits, and I'll just share a personal story because I had been up in Washington and I was in the Capitol doing some advocacy work when the first bell rung to do a vote on coronavirus relief. It was early March and we had a big delegation up and I remember just saying, oh, okay, well, that's relief. It's in New York, kind of problems are brewing in New York, but we're in Texas. And then I returned home and I had spent some time with one of our senators and got a call that morning, the next morning, saying that I needed to quarantine because he may have been exposed to coronavirus. COVID-19 wasn't the name yet. And I did for a couple of days, really unsure of what was happening. And then I took my family on spring break when I got the call that life was going to change. So next slide. So if you think about the early days, the phone call I received was, we're going to have to do something. Restaurants are key. But at the time, everyone has to reflect back that we have 254 counties in the state. And it was confusion. If I was in Collin County in McDonald's and I crossed over into Dallas County the next day, those first couple of weeks, there may be totally different sets of guidelines. And so consumers were getting very frustrated. Operators, some of these, most of our operators in the state operate more than one restaurant or location. They had different rules. And the best way I can describe it was really chaos. And so we were playing whack-a-mole as an association. We actually built a digital board, and we kept all 254 counties and all cities, and we would do updates on what was happening in each so we could give operators real time. You know, I remember having the conversation with the governor's team when they made the decision to close all dining rooms. And as an association executive, it was a really tough moment because I had a choice to make: fight against it or support. But what really happened is that we made an agreement, and that's the fourth bullet, that we would commit to transparency, we would commit to collaboration, and we would commit to keeping people safe. And by doing that, we would be able to get restaurants reopened. So really the reopening was 2 weeks to shore up the supply chain. Restaurants would be open by April 3rd. Honestly, reflecting back, I think we all believed that at the time, because at that moment in Texas, we hadn't suffered the kind of losses that were to come. And so our restaurants closed their doors. A lot of them had a ton of food and items from the St. Patrick's Day, and all of them closed. And the morning of the 20th, when we woke up in Texas, about 34% of restaurants could actually serve any food or take care of a consumer. They were absent a drive-through window. They were absent a to-go strategy. And we certainly didn't have things like alternatives to generate revenue at that moment. The work that we started within, I would say, 4 to 5 days, we had places in Texas that were about to become food scarce. So we have communities that may not have a grocery store, but they have a restaurant. And when those shelves went empty, a lot out of panic, in some cases, there was no food for us to get to them. And I'll talk about some of the things that we did with our governments to kind of get food moving, but also to make sure that we could keep people fed when obviously this closure period went on for much longer. So some of the work that happened on the next slide. Oh, actually, you know what? This is important. I'm going to pause here. One of the things we tried to do early on is to really let consumers, but also our elected officials, understand what was happening in restaurants. We knew if we didn't make a case for reopening restaurants safely, that we could be shuttered for much longer than 2 weeks, let alone the 6 weeks that we were essentially closed. So we created this very short video, but what we were trying to highlight was, what does it feel like to be a restaurant operator today? And frankly, to put the call out for help, that we needed help, that small businesses were beginning to close at a very fast rate, and that we collectively had to do something to protect them. have to say, seeing this again actually brought a little tear to my eye. Wow. Because I just remember back to we were suffering such devastating losses in our own communities. And at the same time, it was amazing to just have to see and hear the losses of these small business owners across our state. Many of the ones that we lost early in the pandemic, which was thousands, were some of our oldest, longest single family businesses that were at the heart of their community. And so this was our first sort of shot across that we needed help. If we look at those first 6 weeks, the state alone lost about 4.2 billion in sales. Those were those small businesses, and about just under 700,000 employees lost their job in the first 2 weeks. It's an extraordinary number, and separate from the health piece of this, the workforce commission and sort of how we keep those employees and what we do in the future to move them to support quickly is certainly something a conversation that we're a part of, because it was staggering losses. And in some cases, it was the most unemployed workers of any sector were in the hospitality space. So next slide. Here's some of the things that we did and we learned from. So one was we had constant communication and really partnership at the federal, state, and local level. So, I was on calls related to issues with President Trump, with Secretary Mnuchin. We were with the governor's reopening team on a daily basis. What's really important is that what was always, I think, very important to our recovery was the health team, the health set of advisors that Governor Abbott had established. We, as the business community or trade association, had no access to those individuals. So what we could do is take best practices. We could assemble working groups. We could come with ideas, but they all went through the reopening team, essentially the task force. But never could we have a conversation with a physician or a doctor that was essentially approving or writing any of the reopening plans. I think that's a best practice, while it might have been frustrating to me at times, because I can remember trying to get buffets reopened in Texas, and it's the last part of restaurants that got reopened, and just going, can I just talk to the medical team? They're safe, I promise. But that firewall that was created, I think, really helped us make better decisions and really led to us having maybe some tighter restrictions that were a little challenging at first, but I think it's what sustained us to remain open and not have a major setback. We had one scale back, but not a major one. We went out and quickly raised $3 million through our foundation, and we just gave out grants to independent restaurants for either food and supplies or to keep their employees on payroll. The very famous now, I think what will always be known for is alcohol to go. And so we were able to say, hey, listen, let's generate revenue. Let's add something to this restaurant's ability. We had passed alcohol delivery in the previous session. And so we were able to create something where if we had packaged it right, and you can see some of the examples, that restaurants could now try to increase that check price. And then we also did groceries. And so I think of County Line Barbecue in the Austin area. And essentially you could roll up in your car safely, pop your trunk. They could put in there a big old thing of toilet paper, a plate of barbecue, and a bunch of alcohol. And so restaurants morph themselves into being a one-stop shop for families. And, they set up, and you can see some of the photos here, they sort of set up their restaurants, all that dining space turned into really a storeroom of things outside of just prepared food. And that actually took a lot of pressure off the grocery stores at the time, and kept people being able to just be in their cars, drive through, get what they need, and go back home. I put the picture of me there because one of the things we promised, and that's the puppy, of course, my family convinced me that we needed in the pandemic, who ended up being my problem. We would just do webinars day and night. I think about it. Some days we just slept at our desks all across Texas, and it was filtering through all the federal information, all the state information, and all the local information. So we could tell every restaurant owner across Texas what they needed to know in a very clear format, and they knew they could trust it at least one time a day. So some of the good work that continued is we decided to support all restaurants. Trade associations are member-driven organizations. But at that point, I made the decision as the leader that we were going to help anyone, whether they were paying us or not. So we became sort of that voice for all things for every restaurant across Texas. It didn't matter. We led on tax and financial relief, working with the comptroller to try to get some relief, and really some payment plans for restaurants. Our own Chip Roy, who's in this picture here, he and I partnered together. We were both new. I think it's a great, it was a Democrat and Republican and a brand new CEO who came together and said, let's change the PPP Flexibility Act. Let's make it so these restaurants and small businesses can use this money longer. And with one no vote, that quickly went through Congress, who does nothing quickly, in Washington. And we were able to extend those funds for businesses across the US and of course here in Texas, and then go back to the legislature and say, don't tax that money. Don't put franchise tax on this money. It's relief money. And we were able to get that done. We wrote really the recommendations for the reopening guidelines. We created the Texas Restaurant Promise. And what's really important about this document, and you can see Matt's El Rancho there, is that it says the Texas restaurant you're walking into is going to promise you this. And you as the customer are committing to this, because we wanted to start from the very beginning as these restaurants reopened, reinforcing that it is a partnership. The restaurant is not in it alone. You as the consumer are not. And if we work together, we can keep these restaurants open and keep people safe. And those were plastered everywhere across Texas. The reopening guidelines was an assembly that we as the association proactively found different folks from small independents up to our very large chain partners. We met every day on Zoom. We talked through what the health team was advising they wanted to see. And then we actually put that onto paper and submitted to the lieutenant governor and the governor, this is how you should reopen restaurants safely. And I think that was taking control of that as an organization. We didn't have anything like this, right? There was no playbook, none, for us to get these businesses through it. And I think from that, we learned that if we can proactively suggest, and then they can come back and say, this is what we'll accept, that is much better than having people that don't have any business experience at all writing policy and asking businesses to implement it. So it was a nice collaboration between health and between the restaurant owners and employees. So on the next slide, this is the this is the timeline, and you can probably see some of it. I'm happy to share. But what this sort of walks through are each of the milestones that the association had within this, really until, it went on for us until early 22. But I think what I value the most is that from the consumers to the industry, which are all the businesses, to the government, we sat in the middle. So our job was to be that conduit between and liaison between what was happening in the legislature, what was happening at the local level, federal level, for any kind of policy and regulations, and advising as thought leaders on the sector. It was making sure our restaurants knew that we were at the table, we were part of the conversations, and that if we worked together in a positive way, that we would get through this. And so that industry, in many cases, the governor would come out with an order, and then within 2 minutes, I would go to the media and talk about why it was a great order, because I was part of understanding what was happening when. And so it was very much a collaboration. And I think that's the difference. I'm, fortunate to be in groups with a lot of my colleagues across the US in different states. And that was not the experience in a lot of states. And I think regardless of what the media may have told you, we were a critical partner in providing information and insights. And we were a critical partner in ensuring in the reopening that the restaurants maintained their piece of the safety equation. And then for consumers, it was all the consumer work that we did to encourage consumers to go back in to restaurants. We were stuck in a lot of really hard places, masks or no masks, vaccine or no vaccine. And what we always went down the middle of the road, and we said always that the Restaurant Association will advise you of best practices and what is required. As a business owner, you make the judgment what's best for your business. I learned very quickly as a girl from a little small town in Connecticut that Texas is very unique, and that people in East Texas may not feel the same way as people in Austin or in Lubbock. And so we had to sort of navigate all the local politics and try to come in, a lot of times, is that intermediary to share what was the fact, what was the truth. And at every single moment, it was communicating to both the media and our members that we had to work together. The media was a challenge in some regards, because we all know that sometimes the media has kind of the story they want to tell, but we were unafraid to tell a different story and to really always make it about saving lives and saving businesses. We didn't see them as mutually exclusive. So on the next slide, coming out of post-pandemic, we are very fortunate to be in a state that people love restaurants. So we currently have 55,000 locations. We're now 11% of the private sector employment in the state. We're the second largest private sector employer in the state of Texas. By mid next year, we'll hit $1 trillion or 100 billion, I'm sorry. So that is an unbelievable amount of money that's in the Texas economy. And what I like to remind people of is that for every dollar you spend in a restaurant, $2.37 is produced in that local economy. So we are producers. And I think that's critically important. Not only do we hire a very large number of people, but the money spent in restaurants really is about producing local value to that community. So our restaurant employment has will reach essentially pre-pandemic levels by 2023. You can look back and see the numbers of 2020, kind of the hit we took, but then you can see as it starts to scale up. What's interesting in the July jobs report, it appears that there are more individuals looking for jobs within the hospitality sector, and it kind of hinted at it in June. And what that means to us, and something we have to remember as an organization, is that we had almost 700,000 people unemployed, right? Restaurants were shut down and they let their staff go because at that time there was no indication of anything coming for help. Well, those employees went off and found other work, or they were disenfranchised, or frankly, when they were asked to come back before we had any type of formal protections, a lot of them decided to go put their talents elsewhere. I think what's happening now is when you see the slide coming up on wages, the wage growth and sort of the flexibility of the sector, that you can do this as a part-time job, a full-time job, you can be 16 or you can be 70. That's where that really sits, in that we're starting to see people look for more of these jobs. This is where we are from a restaurant employment compared to that April 19 level. So we've recovered really nicely. You can see where those states are still really struggling to fill jobs. And if you can't fill every job, you can't fill every seat. So that is the critical kind of economic part of not having the labor force that you need to sort of win across the state. And then you can see here, this one I put because Texas, we canceled a lot of conventions. We canceled a lot of business meetings in the pandemic. And now our cities are sort of roaring back, which is helping tremendously, because the area of Texas that is yet to recover fully from the pandemic when it comes to the hospitality industry and restaurants specifically is our cities. The workforce has not come back. If they do have a leased building, they're not coming back 5 days a week. And so we rely a lot on international travelers. And you can see that it won't be until 2025 that we get back to that level. It's a very high spend individual, that traveler. And so that really hurts, especially in those finer dining restaurants or high-end restaurants in our cities. Travel and tourism, $3 and $10 is spent in restaurants from travelers and visitors. Fine dining restaurants, 41%. So if you've got a downtown Houston restaurant that doesn't have that lunch business really traffic anymore, and you don't have that traveler coming into the city, that's why you're seeing a lot of restaurants today, even in 2023, mid 2023, that are still closing in those downtown city centers because they're getting squeezed from both sides. And then if you look at the next slide, this really shows the really growth in labor costs, right? And so that's good for the employee, but you can see the jump from 20 to 21 in the average hourly earnings. We are up to north of about $33 for a tipped employee per hour. And most of the folks that are in the back of the house, they're up to almost $20 an hour, that's 16 to 20. So in one way, that is the crisis that occurred and the rebuilding that was needed, and sort of this great resignation we're hearing about, there's no doubt that the restaurant sector, you have seen incredible gains in employee wages. But on the flip side, that's negatively impacted the P&L of a restaurant that typically makes 3 to 4% margin. Wholesale food prices, I think we need an entire day to talk about the supply chain. The supply chain impacted restaurants tremendously. Couldn't get food, or food that we needed was completely unavailable or so expensive that you couldn't afford to put it on your menu. You can see here that even last year, wholesale food prices were up almost 15%, but on an aggregate, we're over 20% in the increase of prices. And we've seen items like eggs or chicken wings or corn oil, in some cases, go up to the highest levels ever recorded. And that's just in the last 2 years. So that's put extraordinary pressure on the P&L of a restaurant, because you can only raise prices so far as our consumer tends to get squeezed more at home. So advocacy, this is, I think, really the best part of it is, what did we learn and what did we do with it? So at the Capitol in the 87th legislative session, which was the one that we came right out of. So we went back and we made alcohol to go something that would be there forever for restaurants. So the next pandemic, it's not a question. We made sure the PPP funds were deductible. We went in and gave our restaurants third-party delivery protections. One of the huge booms in the pandemic was the role of delivery. And so there were really no guidelines, and a lot of restaurants got taken advantage of because they wanted to sign a contract in any hope they could generate business. So we worked with the delivery community and we provided protections for our restaurants going forward. We also were able to look at a bulk food waiver. So that means when there's an ice storm, which is, we're always feeding hospitals and people that are stuck, there's a next ice storm or pandemic, restaurants can sell bulk food. So they can go back and turn into those meal kits or bulk items that a grocery store would typically be selling. Now the restaurant forever has that ability. We protected the business community on liability protections around COVID. The risk really wasn't that you weren't being safe and COVID was going to be transmitted. The issue was you had a lot of trial lawyers looking at this feeding frenzy of going to a small business with an employee, claiming COVID was, essentially passed on to them there. And it really wasn't about the causation, being able to really clearly find that. It was much more about the restaurant's inability to fund any type of, lawsuit in response. So, and then this regulatory consistency is important because it'll come up in the next session. Unemployment tax relief. If you think about 700,000 employees on the sidelines, if we didn't have some type of relief of a COVID waiver, imagine what the unemployment taxes would have been for our restaurant members. They would have gone through the roof to the highest level. So we were able to do two things to get relief for the business community, but also be able to refill the pot. So overall, taxes did not go up. So then if you get to this last session, we just finished, we had 70 wins in 70 days, I like to say, which 70 days is about the days that they're working actively in the Capitol. We had about 1,100 bills that impacted restaurants in some way, which is extraordinary. There's only about, I think, 7,000 bills that were filed, and 1,000 of them touched us, which shows you just the ecosystem restaurants are. And most important is we had 100% success rate blocking bills that we opposed. Lots of people have great ideas, but then we need to either shape that idea to make it workable, or we need to be able to block something altogether. And so the things that we worked on this session as an organization, Joe, next slide. There we go, is business tax relief. We all watched what happened in the first special session and the second special session. Our job was to ensure that businesses, not just restaurant, but all businesses benefited from the tax relief that's coming. So there were proposals that did not include the business community. Well, if you reduce personal property, where do you think that cost is going to go? That's going to go to business. And so we were able to come to a great compromise, and even had a restaurant member on the speaker's ad hoc committee. Swipe fee fairness is for a different day. That's just about the outrageous swipe fees that businesses pay to credit card companies. We passed the Texas Regulatory Consistency Act. I know it's pretty controversial, but for us, having one set of rules on key economic areas was critically important. And so we champion that. It's about 10 years in the making. But for us, knowing that a restaurant can get up and have the same set of sort of labor rules and economic rules to work under no matter where they are in the state was really, really important. And we got that really reinforced in the pandemic. We streamline restaurant regulations. So we're working with the health, I call it not TEPHI because I keep saying your name here, but the dishes. And we're making sure that our health directors, and we're actually forming strategically a much tighter relationship with the health inspectors across Texas, because we know that together we can make safer restaurants. So when those health inspectors are in these restaurants and they find an area of concern, we want them to refer them to the association. Let us get them the training or the resources and mitigate that. So that is not an issue going forward. And that's really that friendship, I call it, because it is a friendship, the strengthening relationship between the local associations of the TRA, which there are 23 across Texas. We feel like that personal relationship with those inspectors and giving them tools and resources really makes everybody better, and certainly makes their job easier if our restaurants are doing everything that they're supposed to be doing. And then on the next slide, this is a huge issue, childcare. This was a major crisis for restaurants. It was a major crisis for Texas, and I would argue it remains a major crisis today. The affordability and access to quality childcare in the state is abysmal. I guess I'll go on record saying that. You know, our employees can't work from home. Our employees have to be out after 5. And less than 5% of our childcare centers can actually offer an employee any type of care after hours. So we are a champion for this. We are the business community. The TRA is leading the way in the interim with a coalition to come up with really solid policies. We have a very large percentage of our children that can't read by the 3rd grade because they don't have access to formal early learning. So we feel as an organization that with our size and scope, that if we start to make this and champion that this is an economic issue along with a health and along with a family issue, that we might get more bipartisan support and more collective support to come up with real world solutions. Employee benefits, we created through the Workforce Commission, a portal now where all employees can go and see what's available to them. So things like Teledoc, which we rolled out as an association, access for $9 a month to full telehealth. You know, what are the care.com, but make it easier for employers to direct their employees to the benefits that they're eligible for or can take advantage of for the health and safety of their family. You probably don't know, but we're harvesting oysters off the coast of Corpus Christi, Texas. We had our first harvest 6 months ago, maybe. It's going very well, but like all things, there's a lot of bureaucracy. So we love when we can produce our own food and our own resources here in Texas. So as this continues to grow with the sort of, I guess, appointment of an advisory board to clear some of the bureaucracy, you'll have a lot more of the oysters that we enjoy here in Texas coming right off our own coast. And then wine collector sales. We love, obviously, the alcohol space as restaurateurs. And that really is that a restaurant owner can now buy a vintage 20-year-old bottle of wine from a collector to sell to a restaurant patron, which is something that's never been done before. So I say this because I think as we go through the road ahead, I just have a number of sort of recommendations that I think should be in consideration. The first one is really that the time to strengthen the relationship between the health community, between the government agencies and the trade groups is today. You know, I was very fortunate. I had actually never been to our Capitol when the pandemic hit, but I literally would call anyone and talk to everyone that could help me. The not understanding who was in which party was incredibly helpful because it didn't matter. My view was we were in it together. So what I learned from that is those relationships are what matters, and that we need to be very intentional now forming those relationships and putting together a collective plan that next time it's not going to be absent of a playbook, but we're actually going to have a real plan. 52% of the food dollars go to restaurants. It is a vital, it's food infrastructure. It's no different than housing. We have to stop looking at this as a nice to have. When the restaurants close, we have people that can't eat. We were able to open shuttered restaurants to collect local farms that were harvesting. We need to look at the local small farms across our state and figure out how to better integrate them into the distribution network, or make them part of that solution, that when there is an event like a sustained ice storm, or in this case, another pandemic, that we already know how to plug those other food sources in that are separate from the main grid, so we can keep food moving and we're not doing what we did last time, which was destroying a lot of food that we had no path to take it from the farm or the production facility. We worked really hard to have the restaurant's meals program set up. We had a lot of elderly and those that were unable to leave their home that did not have access to food. So we worked and built a care package program. So we had local restaurants being funded through government funds to create meals to then deliver through our delivery partners to people all across the state that didn't have access to food. Restaurants are a key piece of that. When there's an ice storm, we're the first to ask, clean out your shelves, let's go feed people, or all the hospitals are shut down. Restaurants, can you help? But that needs to be formalized because they're the right people. And I would say that the biggest example I can get is with Jose Andres' group with World Central Kitchen. When Uvalde occurred and people were just so stunned and heartbroken in those first couple of hours, the TRA and World Central Kitchen worked together to get our restaurants on the ground feeding within 8 hours. That is where restaurants can be great in a health crisis or in an emergency or a crisis like just the horrific events of Uvalde. And I think formalizing that would be such a great strategy for leadership, because it's the restaurant benefits, the people on the ground benefit, and it's already established infrastructure. We don't have to bring it in or build it elsewhere. The packaging between grocery stores and restaurants is different, and the requirements, even from the FDA, are different. I'm now part of a group through Accenture, and we're looking at this. We're looking to say, how do we make these supply chains, as we whipsawed back and forth? Is there anything we can be doing now to streamline how we move product between the two? Because you would have a deficit at the grocery, and then they'd go pull everything over weeks period of time from the restaurant supply chain. They would be, bleak, absent, and we'd have to swing back. I think that's a lot of good work, but here in Texas, it's something that we could be looking at as well. And then I think finalizing the restaurant pandemic plan or the retail pandemic plan, right? Really putting the work in today between all the key stakeholders that we have. What are the closing guidelines? What are the reopening guidelines? And that we have thresholds. So it will take some of the ambiguity out of the system. And instead of waiting for a magic number, or if our hospitalizations equal this, and then having 7 people tracking hospitalizations with 7 different metrics doesn't build trust. So I think having that one source of truth for each of the major industries in the state that play a vital role in a health crisis, I think that's work that should be happening now. And I know as an association, we'd be very grateful to be part of. So with that, I will leave it. I hope I'm good on time. I will leave it for, I guess, questions.
We're very good on time, and I believe Janelle or Rocio is going to be digesting the questions that are coming in. But since I have the baton, you have hit a nerve. You have hit my nerve on this one.
Uh-oh.
No, it's good. No, a good nerve. No, but amen. I thought it was a wonderful presentation, but a specific question that maybe you can help me with is that. And everybody was scrambling during the pandemic, but a decision was made about occupancy, right? And to my knowledge, occupancy is designed for fire loading.
Correct.
And I would welcome your commentary on decisions regarding public health versus that.
Yeah, that's very controversial. It's funny you say it because it just brings me back to this moment of.
Sorry, I don't mean to dredge up bad news.
No, because it just reinforces, right, that you're trying to grab for some metric of consistency, right? And really the health team drove that percentage because I think they needed one set, which was let's base it on occupancy. But occupancy, we pushed back initially because occupancy, you have some restaurants that have very high occupancy, but the tables would be on top of each other. And so, and listen, we had a goal. We didn't want to be closed again. So we wanted to do it right and do it more slowly, maybe than even our business owners wanted. But we knew that if we had a massive spike, we were going to go back to being closed. So the mix was take the fire occupancy, let's say it's 300, but then put X feet between each table. So most restaurants never really got up to more than about 60%, maybe 50%, because they would have the right number of occupants. But when you have to put 6 feet or 4 feet between tables, when we reduced it, and then remember your booths had to have X number of feet of protection between them. And so once you did that, you had a majority of restaurants that couldn't get to 50%, even though they were allowed to be open as we stepped up to 100%.
Right.
So I think it's that metric they chose.
Right. So I understand, given the challenge of the day, but I guess going forward with regard to advocacy, I think it would be interesting to say, or to ask the question and maybe collect the evidence, the data that perhaps fire loading bases for occupancy are not appropriate for an infectious disease.
Well, and they almost weren't really included anyway, because the minute you tell a restaurant they have to have X feet between tables, it doesn't matter what the occupancy is.
Right.
Right.
So I'm just kind of moving ahead on the checkerboard, I guess.
I agree with you. And really the real reality wasn't you can open to your occupancy. The reality to a restaurant, what they encountered from what they were told was this many feet between patrons, your bar cannot be open, your booths have to have this, or you can't sit back to back. And so at the end of the day, even the opening at 25% was nowhere near that, because
all of us, I remember early on with the creation of TEPHI, we were getting asked appropriately to help operationalize what this guidance was that was coming out from the well-intentioned public health agencies, right? They're trying to do the right thing, but how do I put that into practice? So it's
and that's, I think, where our role came in, really, right? It was about, masks, about employees, about condiments on tables, about silverware, right? What were those high risk items? And then what were those items? And if you reflect back to date, there was not a significant outbreak at a restaurant.
Correct.
Right. And I think that's really important, because there was a lot of fear. And trust me, the day the doors opened, I was terrified because I didn't want them to close. And I certainly didn't want anyone to get sick. And I get goosebumps talking about it today, the personal responsibility we felt. But I still so important. Nobody knew, not even the health team knew. Right? Were menus safe or not safe? Well, looking back, they were probably safe. We don't know, right? So that partnership is so critical, right? When you can call and say, hey, Emily, this is what we're thinking. And I can say, well, what are you trying to accomplish? That won't work in the restaurant. But if you're trying to accomplish this, what if we did that? Some of those were the best conversations we had.
I agree. So Janelle or Rocio, I see there's chat things showing up and someone's synthesizing the questions. I didn't mean to.
Yeah. So we do have a question from one of our audience members. They recently went to Minneapolis, and they were saying that, they're not sure if this was like a city or county or state legislation, but every restaurant they went to had a service charge of as high as 22%. Added to the bill, and this was not for gratuity or for fair, or it was for fair wages and health insurance for the staff. Just want to hear your thoughts on that, or if anything like that this exists in Texas yet. She was forced to eat out because it was a work trip, but if she lived there, the sticker shock of the bill might detour from me, from her wanting to love, and the idea of protecting workers is making sure they are getting paid well.
Yes. Wow, what a great question. Because if you were to pick up the Wall Street Journal, the New York Times, this is a very timely conversation. We had it begin here in the pandemic. So one of our, really Texas-wide known barbecue restaurants put a $1 surcharge and called it a COVID surcharge on every ticket. And there was tremendous backlash. So there are two sides of this. The idea of putting a service charge on to try to help the restaurant with soaring food and labor costs is not something that we support. A, because the consumer is already paying more for what they're buying at that restaurant. B, they weren't part of that conversation to want to donate. And C, they're also feeling so squeezed as a consumer that giving more is not something that they are excited about. There is a national sort of coming together of consumers saying enough, and it goes alongside the tipping. So if you were to drive through even a coffee restaurant, they flip that board over, and for taking your order, there's a 20, 25, 30%. So there's something called tipping fatigue happening. Interesting, tips for employees are way up, but the service charge is not something in Texas that we think is a good idea, nor have consumers told us is something they want to see. When it comes to health insurance, those larger scale restaurants that are required to provide health insurance, they do. Very few employees take it up. However, what we did was that's where our Teladoc partnership came in. And we went to Teladoc and said, listen, we've got to give our employees something that they can afford, especially some of our younger employees that will not pay for full-fledged comprehensive health insurance. So we rolled out $9 a month per employee. It covers their entire family, and it covers 100% mental health coverage, which is critical in our sector, especially for employees who've come through a pandemic. So we as an association are trying to provide our members with scalable, affordable solutions to address these things because the employees are so critical to us. But that, and by the way, that surcharge you saw in Minnesota, I haven't seen one that high, which is sort of extraordinary. But that is not something we advocate as being a good idea for a restaurant to implement.
Okay, thank you. Another question we have, if another pandemic starts, maybe even worse than COVID, what would you think everyone should do differently in the new pandemic in regards to restaurants?
Yeah, I mean, I think we have a plan. I think we have a lot of learnings here. And the first thing we need is kind of a plan, right? If there's a crisis on a ship or on a plane, there's a book you refer to. So I think that for me, almost a checklist. And I think we have a lot of the pieces, the things that worked, the things that didn't work, and putting together that restaurant, like we had to rebuild the reopening guidelines or build the closing guidelines. There's a lot of work that can be done to tell the restaurants, we're going to be shut down. And think in some cases, it's even a current ice storm when, a community closes for an entire week, the restaurant food spoils. How do we feed that to our local food communities before it does? There are lots of things that we could put together that when the crisis hit, the hurricane hits, or the next pandemic, that we sort of have a playbook for restaurants. I think because of the role that we play in the state in feeding, I think it's really, really important that that happens, and that it's a really collaboration between, in particular, the health leaders and the industry leaders. And I think that's the first thing I would say is you'd have to have something to refer to. The game was changing sometimes by the hour. And so you had federal, you had state, and then you had local communities. You had leaders that didn't want to follow orders, leaders who wanted to make their own orders. And as an association, we had to navigate through all of that. So I think having that written document and really that true pandemic plan, that's the first thing that I would do and I would refer to. I also think we were taught a very important lesson that our industry partners, like for us, the TRA, can be a very key partner in reinforcing a message, especially one that our constituents don't want to hear. But we know that for the collective effort, it's better. And for us to be the ones taking those hits in some cases is a really good strategy, because it allows us to say, I know you heard this and you don't like it, but this is why it means something to you and why you should follow it. And I think that's the role that any organization who has a strong trade association in a state should be at that table. because we were able to mitigate a lot of dissent when things like we had to get rolled back or we couldn't do X anymore. We were able to say the why, the how, and it felt less like a mandate and more like a piece of the path to sort of, freedom and reopening.
So Emily, real quick, because ironically enough, Janelle and I were on the call yesterday for a future TEPHI speaker with regard to critical infrastructure. And you're familiar, there's like these 16 categories. But are you guys within the Texas Restaurant Association pursuing, I don't know, for lack of a better term, formal engagement? I did not fully appreciate how important the restaurant with regard the industry with regard to food delivery to the public. You schooled me on that. And I'm not sure the average person understands that piece.
Right.
Yeah. So
no, we would, and that's a lot of this, and why I'm so grateful that you provided us this opportunity, is to really remind people, right, of the role and the criticality. And I say, because we're in this, incredible heat, situation, and I can imagine, unfortunately, another big ice event or a storm event or what's happening in South Texas, really looking at the restaurants is that partner. It's advocating and really awareness that we need to continue to bring to organizations like yourselves. So you say, wait a minute, we're about to work on this. We should probably make sure the restaurants are at the table.
Right.
I think it's key.
Right. Yeah, literally. Thank you. So, okay, we're getting to the tail end here, and I think I'm supposed to kick it back to Janelle. You have some wrap up stuff. By the way, thank you so much.
Yes.
Of course.
Yeah.
Yes.
So, yeah. Thank you.
Great. We actually have some more questions that we weren't able to get to. And I would love to show one more slide, Joe, if I can take control again. And great. And this slide is really to complete the evaluation survey as a reminder. In addition, I wanted to remind folks that you can get in touch with us and ask us for lots of different kinds of training and for lots of different kinds of topics for this TEPHI Talks webinar series. Emily, that was fabulous. Thank you. You're getting a lot of kudos online in the chat and the
good.
and in the Q&A box, as well as to my cell phone.
And Janelle, this is recorded, so others,
Yes.
if they wish to.
Yes.
Sure.
So everybody who registered, as a reminder, everyone who registered, in about a week, you're going to receive an email from us. That email is going to contain a link to a recording, and that recording will be on our YouTube channel. So be on the lookout for that link. But I really want everyone to fill out that evaluation survey. And thank you again, Dr. Williams-Knight, for a wonderful presentation. Too bad we weren't able to get to all of the questions.
Thank you so much.
Bob?
Okay. All right. Well,
Okay.
yeah, thank you again. Yeah, thanks. And now I'm all energetic to go to a restaurant.
Yes, please, everyone go out and eat tonight. Please.
Okay. Yeah,
You'll
there
love
you go.
that.
Everybody go out to eat. Okay.
We have really good air conditioning in all of our restaurants.
Okay. Well,
Thank
thank
you
you
so
so
much.
much for joining in. And yeah, thanks, Joe, behind the scenes. He was
Yes, thank
he was
you.
the puppeteer there.
Amazing.
Take care,
Thank you
guys.
all.
All right, we'll see you.
Bye-bye.
Bye.